So for the purpose of this video, I'm going to be doing principle number 6. There's no process that does not require time. And then principle number 30, the causes of dis-ease, which is interference with the transmission of innate forces causes incoordination or dis-ease. So essentially, to a patient, I would present this in a particular manner of the fact that time is a process that necessarily heals everything. So if you come into, say you came into the office and you had a strain or a sprain, and we were coming together to create a prognosis for you, we would essentially understand that it's not going to heal overnight. We need time in order to make a progression plan, in order to strengthen, in order to make manipulations as needed, so that way we can correct the forces that went wrong, which essentially goes into number 30, which is the disease. So we're not calling it a disease, we're calling it dis-ease, and that's a lack of fluidity of motion and a lack of well, I guess that just sums it up itself. So a lack of fluidity of motion, which causes disease or discomfort or pain, or in a certain patient they have a strain or sprain, there could be muscular imbalances that need to be recorrected, that were weakened in the first place. And so where it comes into play is this time with disease and your innate forces, which is basically your body's processes working together. So you have, say you have a normal workout and you tear your musculature, and that's a natural process that needs to take time to heal and recover. Your satellite cells need to come together and grow your muscles again, build the muscle fibers, send nutrients through your blood, and that's your innate body working through you to recover your muscles. That way, the next time you go to the gym, you're going to be a little bit stronger if you recover properly. Now, for the chiropractic purposes, for us, we essentially have a subluxation, and that subluxation is going to cause a multitude of problems, either muscular or neurological, that we need to look at. And so over time, we are going to be able to prevent the dis-ease and the discomfort and the pain, the lack of transmission of correct communication between your spinal column and the rest of your body. So if your spine is off kilter and we need to go in and make an adjustment, then what I would do is I'd go look to see where exactly your spine was misaligned or where you were having your muscle strained and sprained. And then we create a game plan that helps us assess a reasonable amount of time to create a goal for you to basically start your healing process. You start healing naturally as soon as the injury occurs or the disease occurs. But if we don't create a necessary game plan for that particular injury, and in your case a strain and sprain, we aren't going to combat that very time effectively or time efficiently. And so what we do as chiropractors is essentially use these two principles in conjunction, so that way we can minimize or decrease the amount of time it takes to recover, while also understanding that if we do have an injury, there's going to be a disease and there's going to be lack of function in the body's systems. And so essentially we use these as a way to help us measure where you're at right now, so we can get you where you need to be in the future.